As the world enters the second year still grappling with the COVID-19 pandemic, vaccine inequality continues to hinder global economic growth. According to the Global Risk Report 2022, wealthier countries have a 70% vaccine rate, while African countries are only at 10%. Oxfam International says that vaccine availability could be coordinated differently in a way that its main aim is to end the pandemic. The report also found that at the start of this year, 5.4 million deaths were recorded out of 282 million confirmed COVID-19 cases.
There has been significant vaccine inequality, and as we launched our report yesterday, Inequality Kills. And of course, this vaccine inequality demonstrates it more than anything else. So differences between countries have grown beyond what was seen before. So in this generation, we hadn't seen inequality grow between countries. Some of the COVID vaccines are being sold at cost. And there could be a way of coordinating, so that word that was used by John and Adar and Michael, how would we coordinate differently? But coordinating would require us to think of a vaccine that is there to enable the end of the pandemic, not there to fuel further profit and further hoarding as it is currently.
World Health Organization says the COVID-19 pandemic not only brought sickness and death with it, but also mistrust amongst individuals globally.
Of the most scarce commodities in this whole pandemic response has been trust. Trust between communities and government, trust between countries, trust between manufacturers and purchasers. Trust has been the missing magic dust that makes everything work in life.
Meanwhile, Africa's Central Disease Center Director John Nakasong says as we move into the new year, he hopes to see a rise in the vaccination rate in African countries.
What we have seen over the last 2 years is really total collapse of global cooperation and solidarity, period. I think there's absolutely no reason why a continent of Africa should be lagging behind with having 7% of the population fully immunized. A continent of 1.2 billion people is totally unacceptable.
The World Health Organization says the most vulnerable should continue to be prioritized first with vaccine doses to fight the coronavirus and the new variants. Notando Makutulela, SABC News, Johannesburg.